Stanley M. Bach was born to missionary parents in 1916 in New Zealand. Soon after his birth, the family would be transferred to Japan, where he would learn respect for other cultures. In 1937, he attended Dana College in Blair, Nebraska, where he wrote letters to Japan revealing his plans for the future. I was thinking of studying orthopedic surgery and, of course, pediatrics to go along with it. There would be a lot of satisfaction in being able to put some poor little crippled child back on its feet again. There is a lot that can be done in that field, but the trouble is there are not enough orthopedic surgeons to go around. After graduating medical school and 1 year of internship, he would be drafted.
He went off to the war and served with Patton's Third Army in Europe, and then at the Army hospitals after the war, where they brought many of the giants of surgery and orthopedics together and basically gave these guys an on-the-job experience that rivaled any residency or training program in the country.
I remember him talking about being a pediatric orthopedist. He said, "Karen, I'm one by experience, not by training." When he was in medical school, in residency, there was no such thing as a pediatric orthopedist.
In the horrendous, horrible polio epidemic in 1952, you probably saw most of the children that were in Children's Hospital.
He was instrumental and helped bring the Sister Kinney program to Nebraska, which was a very specific exercise program, where they would literally put the kids through passive motion of their joints so they wouldn't become permanently contracted. Then after the polio epidemic, the people who had residual problems with weakness and needed tendon transfers and stabilization of their feet. And quite honestly, his generation were masters of that kind of surgery.
He had an amazing amount of on-the-job training. When you work that many years with special needs kids, you do stuff that isn't even in the books, and he knew how to do that.
He was very active and involved in the original program at Children's, which didn't used to be called the CDC clinic like we have it now, but it was a very similar concept. And he volunteered many a Wednesday morning to take care of those kids and made sure that as he got older that he brought other people here to take his place and hopefully provide the same kind of care and compassion for the kids. And I think it was his ability to work with people and bring people together that makes him a legend.
Dr. Bach dedicated his life to children that birth, polio, or injury had damaged. His multidisciplinary approach became the standard for treatment of these, the most fragile of children.